everyone. Welcome to Atlanta and Company. Taking a look outside at our fair city. A nice day, big puffy clouds, as my daughter would say. Sunshine and fun. That's what we've got here in the studio. I'm Christine Pilar. It is so great to be with you. But before the fun, we're going to start off with some medical news. You know, for many Americans, it's a daily struggle and painful occurrence. I'm talking about heartburn. You know, that painful, awful feeling after you eat or as you fall asleep? What you may not realize is these symptoms could be a sign of a more serious condition called gastroesophageal reflux disease. But now there's a new FDA-approved device that is improving lives. And here to tell us much more about it is the professor of surgery at the Mayo Clinic, Dr. Daniel Smith, and he's brought along recovering patient John Davis. Welcome to both of you. Thank you for being here.
Thank you. Good morning. Thanks for having us.
Well, doctor, we mentioned the Mayo Clinic, but we should also mention now you currently live and practice here in Atlanta, which is how you met John. But we're going to get to John's story in just a minute because I want to go back. What is gastroesophageal reflux disease, or GERD for short? And I'm going to start saying GERD if that's okay with you.
Yeah.
It's a little easier. So what is it?
Perfect. Well, you know, Christine, you described it very nicely in your intro when you talked about heartburn, chest pain, and symptoms that wake you up at night. What this is acid and digestive juices from the stomach that splash back up or reflux back up into your esophagus, causing all of these symptoms. It's an extremely prevalent problem. 30 million Americans suffer with this on an almost daily basis. And not only does it cause these troubling symptoms, it can also damage your esophagus. And in some patients, it's a precancerous condition.
Wow. So, John, of course, you were going through this. How did it affect your life? What were your symptoms? And, of course, we should mention every patient, every situation is different. But let's talk about how you felt.
It started about 5 years ago. I had the typical heartburn you hear a lot about.
Sure.
Gradually got worse. It was more of an annoyance then.
Right.
Got worse. A few years later, probably 2 years ago, started kind of taking over my life, losing sleep. I couldn't eat. And about 12 months ago, I was actually in a recliner at night having to sleep I can only sleep about an hour a night.
Oh my gosh.
I couldn't eat. I'd lost about 40 pounds. It was awful, terrible. Tried medications and nothing I couldn't get anything to make it stop hurting. It was just burning.
Right, so you needed to
I needed to do something, yes.
Right.
Yes.
And how did you get in touch with a doctor?
Just through referral, friends, started reading about it, heard about it, and didn't know anything about it, just that there was something out there.
Sure.
Yes, made an appointment, and here we are now.
Got the help you needed.
Exactly, yes.
And Dr. Smith, historically, what has that treatment been? What are treatment options that have been available?
Well, Mr. Davis struggled, like many patients do, with being treated only with medicine. And the medicine that's used is intended to neutralize acid and decrease the harsh symptoms. But the fundamental problem in reflux is an ineffective valve between your esophagus and your stomach. So the treatment today that we're going to talk about has to do with reinforcing that valve and helping it be stronger. There have been surgical procedures in the past, but they've been very invasive with troubling side effects. So this new device that we're talking about is much easier and safer to place and has fewer side effects than our traditional surgical options.
And there it is.
If I may, yeah.
Of course, it's that big.
So this is the device. It's called Linx, L-I-N-X, and it's a bracelet of magnetic beads. So each one of these beads is a magnet, and when you wrap it around the esophagus, and I hope people can see that wrapped around my finger.
Yes.
That's wrapped around my finger now, and when patients swallow, the force of swallowing breaks the magnetic seal between the beads, and it opens.
Right. Food
passes, and then it pulls back closed again to help hold that valve closed and prevent that acid from coming out of the stomach into the esophagus.
Fantastic, and that's what you did to John.
That's correct.
And John, how was the procedure for you?
Well, great.
I mean, did you have, having a lot of downtime, or what was it like? You know,
I went in that morning, April 17th. I'll never forget that day. Went in the morning, really didn't know what to expect other than what we had talked about. The staff was excellent. I had the surgery at the surgical center at Dr. Smith's office.
At Piedmont, correct?
Correct, yeah, Buckhead Surgical Center.
Okay.
And I can't say enough about that, about the staff. It was just an amazing experience. I went in that morning, had the surgery, Mid-afternoon, I'm on the way home eating ice cream.
You're kidding.
That night, let me tell you, my favorite drink is cran grape juice.
Okay.
And I could not drink that for a year because it burned so bad. It just hurt. So I said, well, I'm going to test this because I was feeling, other than the discomfort from the surgery itself,
right.
I had no heartburn. And I said, well, I'm going to drink this juice. I'm going to try it out. So I drank a big, tall glass.
Was he allowed to do that, Dr. Smith?
Absolutely.
And
Absolutely.
I was testing it.
Right.
I drank this juice and went and got in bed. And I was a little afraid to lay down because I haven't been able to do that for a year.
Right.
I lay down and woke up 9 hours later, the next morning,
a full
thinking,
night's
wow.
sleep.
And the juice didn't bother me.
That's fantastic.
And it's just amazing how
And you've been feeling great ever since?
Yes.
That's phenomenal. And doctor, who would qualify for this device? Obviously someone who has reached that point that John felt too, where it wasn't just minor heartburn, it was more serious symptoms, right?
Yeah, Mr. Davis's story is pretty typical. And what I would say is if you're having these troubling heartburn symptoms more than a couple of times a week, you really need to find a doctor who can do tests to determine whether you have this more severe form of reflux or not. If you do, and your medicines are failing to control your symptoms, you may be a candidate to have an operation like this to create that better valve rather than using medicine that doesn't address the primary problem.
Exactly.
That's what's exciting about this, is we finally have some technology to directly address the problem, the leaky, weak valve, rather than continuing to spend a fortune on medicine that doesn't address the problem.
And you make sure that everyone should know that it's very important to visit a GERD specialist if you think you're having those symptoms, right?
Absolutely.
All right, well, thank you both for being here. I appreciate it. John, so happy to know you're feeling better. New lease on life, right?
I've got my life back.
Awesome. Thank you so much. Doctor, it's a pleasure meeting you.